one of the more fascinating stories that that I've seen so far this year is the fact that CVS has said that they are going to end tobacco sales, and that is cigarettes, cigars. They're getting rid of tobacco sales. What does that mean to illnesses like lung cancer? Paul Billings from the American Lung Association. What does that mean? How big of a win is that in the fight?
It's a big win, and the fact that the public got so strongly behind CVS when they made this announcement really is encouraging to the Lung Association, all our allies who've been fighting the tobacco industry and fighting this fight for more than 50 years. Cigarettes are linked to lung cancer, chronic obstructive pulmonary disease, heart disease, stroke. You just can't underestimate the toll of tobacco. 480,000 premature deaths every year are caused by cigarettes in this country. So that's a huge, huge burden on the American people and a lot of misery for a lot of families. So for CVS to step forward and say, we're a health company and we're not going to sell these products that kill half of their users when used as intended, it's a huge win for the public.
The thing that I find so fascinating about this story is that, you could have regulations put in place, and I think they're great. You could have warnings put in place, and I think that's great. But the fact that a company as big as CVS said, you know what, we realize that we're making nearly $2 billion off of tobacco sales, and we're good. We're going to walk away from that money. We're going to leave that money on the table. We don't have to have that because we want people to be healthier. I find that to be amazing.
It is truly an act of corporate courage, and we've seen very little of that.
You really have, especially from the tobacco industry.
And the tobacco space, there is no more cynical industry than the tobacco industry. But I think what CVS decided was they were going to be a health company, and it was inconsistent with curing disease and preventing disease to propagate disease. And so they said, enough's enough. We're going to move forward on a healthy path. And we think all retailers should follow them. Target doesn't sell cigarettes. Yeah. Lots of small community pharmacies don't sell cigarettes. We think the entire, all retailers, grocery stores, big box retailers, should follow this lead.
This resonated around the country. It even reached the White House. The White House had plenty to say about it. Let me play that clip of Jay Carney at the White House press brief. I think this was on Wednesday.
The president is, like a reformed smoker, but, and I think he recognizes, like everyone who's quit recognizes, it's not an easy thing to do, but it's the right thing to do for your own health, for your family, and for the nation's health.
Carney even drove home the point that he used to buy his cigarettes from CVS. Like, that was his neighborhood pharmacy, and he would go there and buy his cigarettes from CVS, which is, it really makes it, really drives it home. So, here you have a president who has struggled with cigarettes, right? He says it's been a long time since he's had one, but he's kicked the habit, allegedly, as he says. What's next, I guess? Because you've got the White House that clearly knows that they have to do something with this. They've put out a statement. They commented on it. They know that it's a good thing. So what's next? What's the legislative action?
Well, I'm not sure there's legislative action needed, but I think there's a lot of things that can happen regulatorily. There are regulations pending at the White House right now to expand the FDA regulatory authority over other tobacco products, cigars, little cigars, e-cigarettes. Back in 2009, we passed bipartisan legislation with overwhelming majority the president signed that regulated tobacco products at the FDA. It was a 15-year struggle. Finally got that passed, but there are a lot of rules that are in the pipeline that need to move forward. Also, under the Affordable Care Act, provides coverage for tobacco cessation for the first time. But the White House hasn't defined what that coverage is. So
I was going to say, explain that.
So under the Affordable Care Act, preventive services that are deemed to be effective by something called the U.S. Preventive Services Task Force says if these things work, they should be covered without copay or barrier, give essentially full access for the people, for the public. Tobacco cessation works. It provides tremendous benefits, so it's graded as effective by the U.S. Preventive Services Task Force. But what happens is that then the Affordable Care Act needs to be implemented and define what that benefit is. And we want a comprehensive benefit which follows the guidelines. So access to all 7 FDA-approved medications and 3 forms of counseling, individual, group, and telephone counseling. So we know quitting smoking is hard. At the American Lung Association, we've helped millions of people quit smoking. It's a really powerful addiction. And so we want to give people all the tools available to them and as much opportunity to quit as they can. We know 7 out of 10 people who smoke want to quit, but it's really hard and takes many attempts. So we want to provide that environment and all of that support they can to quit smoking.
Taking your calls at 866-55-PRESS, 866-557-7377. I'd love to hear from you all about what you think about CVS dropping tobacco products and how you think that's going to play into the overall war on tobacco, as I'm calling it. You mentioned e-cigarettes there. I want to talk a little bit about e-cigarettes because I know some people who smoke e-cigarettes, and I'll ask them, what's the deal with e-cigarettes? And I can never get a straight answer of, what is in an e-cigarette? How does it work? And I always hear water vapor. But it's not just that, right? I mean, what's the deal?
Yeah, we don't really know exactly what's in e-cigarettes.
Oh, good. Oh, okay. Oh, wow.
There are more than 250 different varieties, according to one study. The FDA did some initial analysis a few years ago and found that there were carcinogens and the same chemical that's in antifreeze in e-cigarettes. There are studies that talk about the secondhand emissions of e-cigarettes. So what FDA needs to do is step forward and regulate these products. We need to understand what's in them. We have companies making all kinds of outrageous health claims, which they should not be allowed to do, and FDA should crack down on that. And they also make them in flavors like Captain Crunch and Gummy Bear and Cotton Candy. So they're clearly marketing and targeting kids, and CDC found that in 1 year e-cigarette use among kids has doubled. So we got a problem out there, and we need to step forward and address it.
It seems like I don't think a lot of people are taking the e-cigarette thing seriously. I think that they look at it almost like candy cigarettes, like it's not a real issue. But to hear that and to know what's in it, or I guess to not know what's in it, is so scary, I think, and I'm surprised that we're not hearing more about it.
Well, I think a lot of people are hoping, looking for a panacea to this problem, and certainly at the Lung Association, we've been fighting the tobacco industry for a long time, and we know what works: raising tobacco taxes, comprehensive smoke-free air laws, and comprehensive funding of prevention, education, and cessation programs. That's what works. And hoping that there's some magic out there, I think, is fantasy. What we really need to do is move forward with the steps that we know work. It's hard, but we need to move forward with those.
It is truly amazing. I was having this conversation with someone the other day. Like, it wasn't that long ago that there were non-smoking and smoking sections in restaurants.
There still are in parts of the country. We only have 28 states that have comprehensive smoke-free air laws.
Wow.
So, so we still have a ways to go.
I'm trying to think of the last time I walked into somewhere that actually still had cigarette smoke in a restaurant. But yeah, I mean, look, I think it's a great thing. And to be perfectly honest, I was one of the people who said, let the restaurants decide if that's what they want to do. But I have to tell you, now that it's happened in a lot of states, I love it. Yeah. I love it. I think it's such a good thing.
Well, when I first started doing this work, we were still getting smoking off airplanes. There was this magic barrier on row 18 that all of a sudden the smoke didn't penetrate.
Smoke won't come back here.
And when I was a kid, they used to give free cigarettes with the meals on the planes.
Whoa.
So,
talk a little bit about the most recent science on smoking, because I think that this generation, whether they follow the science. I mean, this generation was brought up knowing cigarettes are really, really bad for you, right? Like you could say before this, there might have been some ignorance on the issue, or started smoking when they were younger when they didn't realize it was so bad. But how bad are cigarettes?
Well, one of the things we know is that I think there is strong awareness of what the health risks are, but still, nearly 1,000 kids start smoking every day. Mm-hmm. So actually earlier this week, the FDA launched a new campaign targeting kids. And it's not the threat of heart disease or chronic obstructive pulmonary disease 10, 20, 30, 50 years down the road that speaks to the teens. So their campaign is really focusing on tooth loss and wrinkles and bad breath and those kinds of things that are impactful to teens. But cigarettes really are terrible. 480,000 premature deaths are caused each year by tobacco use, according to the latest Surgeon General's report. And virtually every system of the body is impacted negatively by tobacco use. So we talk a lot about lung cancer and COPD and heart disease, but it's also stroke. In fact, the new Surgeon General's report linked it to diabetes and tuberculosis. So there are challenges for the body if you smoke across the whole range of your systems, and there really is probably nothing more terrible you can do to yourself than protect your health more than smoking cigarettes.